as the broader membership of both the Senate and the House now get to weigh in. I'm Sherman Ricepeas in New York.
The world has about 37.7 million people living with HIV, according to World Health Organization. Despite measures being put in place, like promotion of safer sex, which play a critical role in reducing infections, many still continue getting infected, and girls, as well as young women, have been seen to be more prone to this, and them being at high risk spells quite a gloomy picture in the fight. Our Lusaka correspondent Arthur Davis Sikopo now takes a look at some of the statistics and challenges in Zambia and some measures needed to help in the fight against HIV, especially in girls and young people.
There are 5,000 new HIV infections every week in girls and young women between the ages of 15 and 24, according to a 2021 report by the United Nations Programme on HIV/AIDS, UNAIDS. And from that 5,000, over 4,200 infections are happening in sub-Saharan Africa. This report has been of concern to people and organizations involved in the fight against HIV/AIDS, like Maxwell Mumba, a young advocate from Lusaka in Zambia.
This keeps me worried. The fears are such that if we have such new infections, are we near to end AIDS by 2030?
UNAIDS Executive Director Winnie Byanyima was in Zambia to appreciate the HIV/AIDS program and the HIV/AIDS education program targeted at children and adolescents in the southern African country that today has 1.3 million people known to have HIV. During her mission to Zambia, the UNAIDS Executive Director interacted with the President of Zambia, ministers and other parliamentarians, civic and some community leaders, among other stakeholders, where she expressed concern that girls and women are at high risk, accounting to 63% of those infected with HIV in 2020.
You are going to school, hiding from your schoolmates. It's harder to protect young children. Also the transmission to babies. The women having the babies are children themselves. Often it means when she gets pregnant, this is where social protection comes in.
It has been established in various reports that girls and young women, especially those in Africa, get HIV due to many factors like poverty, inadequate medical supply or health care, experiencing sexual acts after reaching puberty, and being trained under traditional practices, lack of negotiating for safer sex, like the use of condoms, being abused by either family or community members, among others. Zambia's Minister of Education, Douglas Yakalima, confirms the challenges that the girls and young women face that contribute to the rise of HIV cases in the country.
And then people take advantage of them. Just here in Chibombo, I found 116 early marriages. Muchenga province, I had to retrieve about 8 kids from marriages. It's a mammoth task, but I think society will start responding.
However, despite having concerns of continued high infection rate among girls and young women, Zambia has made progress in regards attaining some set international targets. As Sylvia Masebo, Minister of Health, confirms that Zambia has met the 90% of people who are living with HIV/AIDS knowing their status, and 90% of those that know their status being on treatment, and 90% of those on treatment having their viral load suppressed. However, she raises worries on the 95-95-95 target on children.
In children between 0 to 14 years, the 95-95 targets are as follows: 60.5, 93.2, and 80.7. This is below the national average, which I mentioned earlier. So you can see that again, even there we still have issues.
For young advocate Maxwell Mumba, investment in digital space is one key in fighting HIV new infections.
How can we utilize social media platforms just to talk more about PrEP? But so long as if we don't invest into the digital space where these young people can have this information readily available, it's going to be a bit of a challenging factor.
Maxwell Mumba is now offering solutions to the fight against HIV/AIDS
by ensuring that they begin at a tender age to educate their children, like they will be taught to go to a certain church or religion at a younger age. We have to strengthen the whole strategies in terms of sub-Saharan Africa.
With his 13 years of advocacy around HIV/AIDS, Maxwell is hopeful for a positive future regards ending AIDS.
We are coming from the days where people would take 5 tablets in the morning, 5 tablets in the evening, and today it's 1 tablet a day. So, which shows that there's a greater light of us fighting the battle between HIV and AIDS, and we are winning it because a lot of people are becoming virally suppressed and living healthy lifestyles.
The UNAIDS chief is promising to help mobilize donors, help in policy formulation, among others. Reporting for the SABC's Channel Africa in Lusaka, Zambia, I am Arthur Davis, Scopo.
New measures are underway to dismantle the human trafficking networks operating within the Dzaleka refugee camp in Malawi. This includes identifying and rescuing the victims and bringing those responsible to justice. UNODC coached and mentored 28 camp officials and law enforcement officers who are now involved in the identification of victims and the investigation of trafficking cases, and will train other colleagues at police stations and border crossing posts. Since the training and the implementation of new anti-trafficking procedures, over 90 victims of human trafficking have been identified and rescued. The guidelines for the identification, rescue and referral of victims were developed by UNODC with the support of the UN Refugee Agency, UNHCR, and the International Organization for Migration, the IOM. Now, to discuss this further, we have on the line UNHCR Durable Solutions Officer in Malawi, Byanyima Miro. Byanyima, thank you so much for joining us and welcome to the show.
Thank you very much. I'm happy to be on the show.
Now, how did the new measures come about?